We will talk about lipoma. What is lipoma? It is benign tumor. It is composed of fat cells or fat tissue. It is the most common benign tumor. Lipoma affects around 1% of general population, and in many cases it is underdiagnosed because it is painless and it has no symptoms. It is movable. It moves. It's important because it's not attached firmly. It's moved under the skin usually, and it's soft to touch. It's not firm. Usually lipoma is 1 to 3 centimeters in diameter, but it can be larger. It can be even 10 centimeters in size. And very important sign is slippage sign. Slippage sign means that it's movable. When you touch it, it's movable. It's very important. You can differentiate it from other lumps and other growth under the skin, that it's movable. It's important sign. Lipoma can develop anywhere, and location can be almost any part of the body, but most common areas are neck, shoulders, back, arm, and thighs. Sometimes, very rare cases, it can be affected. It can affect different parts of the body, including internal organs, for example, lungs or even brain. But such cases are very rare. Such cases are extremely rare. Most commonly, it affects neck, shoulders, back, arms, and thighs. Now let's say, what is the risk factors of lipoma? Why lipoma develops? We don't know why it develops, but we know that it has important part of genetics. Also, minor traumas increases risk, small traumas, injuries, and Cowden Syndrome. Cowden Syndrome is a condition where there is increased risk of several types of cancers and several types of growth in the body, including lipomas, including thyroid cancer, including breast cancer. So Cowden syndrome can increase risk of lipoma, and also several other conditions, several other rare syndromes can increase risk of lipoma. But usually it's sporadic. Usually we can't have clear genetic connections, but people whose family members, for example parents, has lipomas, they have higher risk of lipomas also, but this risk is not very high. How we diagnose lipoma? Usually with physical examination, but sometimes ultrasound is required, or sometimes computed tomography, or magnetic resonance tomography also needed, but such cases are rare. Usually it's diagnosed via physical examination. What is the treatment of lipomas? Usually lipoma does not require any treatment. It's harmless condition, and people have it whole time and no problem. It has no risk. It has very minimal risk, almost zero, to malignate. So to become malignant, risk is very low. So it has no problem, no major problems. Sometimes it can grow large and it can compress nerves or compress other organs, but such cases are also rare. So usually no need any treatment. If there is cosmetic problem or subjective problems, person does not want lipoma, then treatment is surgery. After surgery, usually no recurrence of lipoma. Prognosis is excellent. Lipoma itself is not harmful. It does not cause any important problems. And we should mention also familial multiple lipomatosis. It's condition when person has many lipomas on the body, and it's usually genetic. It's genetical. There is 50% chance that if parent has multiple lipomas, his child also will have multiple lipomas. It has 50% chance. It's strongly genetic. It is called familial multiple lipomatosis. That's all I wanted to say about lipoma. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.